cusp of Sri Lanka starting the recovery journey and the building up journey after Cyclone Ditwa. And from all the sectors that have been impacted, healthcare sector too, I think, is probably on top of the list. How would you assess the actual impact on the sector, looking at the vast amount of stakeholders that are in it?
I think the cyclone has clearly exposed vulnerabilities in the healthcare system. Our healthcare depends on this network effect. We have central hospitals, we have rural hospitals, we have connectivity between the two, both in supply chain, physical goods as well as services. So in our engagement with the health ministry, there's a lot of learning for us in terms of vulnerabilities that have been exposed. Sri Lanka has not prioritized enough investment in the healthcare system, and this is coming to bear. It's in these shocks that we see this. So it has shown us systemic challenges in both internal as well as external challenges.
If you could just give me a timeline of what are the short-term, mid-term and the long-term priorities that we should be looking at?
I think short-term has to be providing access to those who have been challenged to receive access between cyclone impacted as well as resuming normalcy in every other chronic care which has been disrupted. We have a new mindset about us in the country, both the government and the private sector. This is an opportunity to rebuild differently. Beyond that, I think we as Sri Lankans have to understand we underinvest in our healthcare system. I know all of us heard about 6% in education. We didn't talk about that in healthcare, right? And healthcare impacts all Sri Lankans. The private sector must also see healthcare investment as necessary. A productive, healthy workforce is the engine of growth.
Cyclone Ditwa impacted Sri Lanka severely. What happened to the healthcare sector? We spoke about all of this and more with Shyam Sathasivam. Stay tuned.
For 30 years, LMD has been the voice of business in Sri Lanka, capturing the pulse of the nation's corporate landscape through its iconic covers. Each cover tells a story, from the first edition in 1994 to the present day, narrating key moments, leaders and trends that have shaped Sri Lanka's business ecosystem. Over the years, LMD covers have featured thought leaders, business pioneers and game-changing innovations, reflecting the evolution of industries and the economy. As we celebrate 30 years, these covers represent more than just publications. They are a testament to LMD's legacy of excellence in business journalism and its unwavering commitment to being Sri Lanka's leading voice of business. LMD, Sri Lanka's voice of business, a legacy of 30 years.
Hello and welcome to LMDtv. We're focusing on the healthcare sector today, and I'm here with the Group CEO of Sunshine Holdings, Shyam Sathasivam. Welcome to our show, Shyam.
Thank you.
We are at the cusp of Sri Lanka starting the recovery journey and the building up journey after Cyclone Ditwa. And from all the sectors that have been impacted, healthcare sector too, I think, is probably on top of the list. From where you stand, how would you assess the actual impact on the sector, looking at the vast amount of stakeholders that are in it?
I think the cyclone has clearly exposed vulnerabilities in the healthcare system, as it has done across multiple infrastructure systems. Our healthcare depends on this network effect. We have central hospitals, we have rural hospitals, we have connectivity between the two, both in supply chain, physical goods as well as services. So in that context, inability to connect with each other, the sort of lack of telecom systems, lack of road network, rail, all had a big impact on quality of care during this period, and we have yet to recover fully. So in our engagement with the health ministry, there's a lot of learning for us in terms of vulnerabilities that have been exposed. We're talking about chronic underinvestment over many years. Sri Lanka has not prioritized enough investment in the healthcare system, and this is coming to bear. It's in these shocks that we see this. For us as a company, Sunshine Healthcare, was challenged by the infrastructure issues. We are one of the largest national players in healthcare, especially in pharmaceutical products in the private sector. We distribute to over 2,000 pharmacies daily. So the scale of the impact was very visible to our teams. First, to keep our team safe, our products undamaged, but then also to get them to who needs it. So it has shown us systemic challenges in both internal as well as external challenges.
And I don't even know where to start on how we can overcome the challenges, but if you could just give me a timeline of what are the short-term, mid-term and the long-term priorities that we should be looking at.
I think short term has to be providing access to those who have been challenged to receive access between cyclone impacted as well as resuming normalcy in every other chronic care which has been disrupted. So we have to go back and treat those who require immediate care and therefore provide either medicines that are required in locations that don't have them and redirect resources into those areas. But we have to be patient. We cannot fix what has taken so many years to break, or the chronic underinvestment I spoke about quickly. There is no short fix that we can go back to how life is in a couple of weeks, right? There are some systemic weaknesses that have been exposed and which will take planning, thinking, and maybe an opportunity to fix it differently. Maybe we shouldn't go back and just patch it up. We should look at doing things differently now. We have a new mindset about us in the country, both the government and the private sector. This is an opportunity to rebuild differently. In the private sector, I think there is opportunities for us to reset in terms of supply chain shocks. What has happened? There have been losses in the network, especially we're talking about nearly 500 pharmacies, for example, or in the government sector, nearly 100 sort of base hospitals, rural locations, some district hospitals, some wards have been affected. All of that will take time to recover. Beyond that, I think we as Sri Lankans have to understand we underinvest in our healthcare system. The current 2 to 3% of GDP spent on healthcare has been one of the best returns of investment any country has made in healthcare. Our infant mortality rates, our maternal mortality rates, our life expectancy are phenomenally good for what has been very low investment. So I know all of us heard about 6% in education. We didn't talk about that in healthcare, right? And healthcare impacts all Sri Lankans. The private sector must also see healthcare investment as necessary. A productive, healthy workforce is the engine of growth.
And I mean, I know the private sector always gets burdened in a way as being the engine of growth, driving this forward. But are there any priorities that you think the government should ensure in terms of, policy or systemic infrastructure so that the private sector can build on it?
Sure. It is always a partnership. I think the private sector succeeds when there is good governance, when there is clarity, policy stability, communication. There can be changes, there will be changes, right? From what we are seeing, AI is going to impact. So we cannot have consistency that overcomes technological advancements. We are going to have to change both the private sector and government. We are going to have to leapfrog. Some of our ideas are outdated today. We can't keep on. They were dated maybe 2 years ago. They probably don't rely. Digital infrastructure is going to roll out in a phenomenally different way. All patients now will want access to their electronic medical records.
That's true.
So we may have to go past all paper documents and sort of those hospital cards we used to carry. All of our children have these vaccine cards. Those are all not relevant today, right? So I think in that context, we will also have to invest as the private sector. Probably expect too much from each other. So I think we may have to reset. The government cannot solve every problem so that we can make profit, right? Nor can the government expect the private sector to independently resolve matters. We have to find a middle ground. Primary care will continue to be the responsibility of government. But tertiary care clearly can be a place where the private sector can lead the way because it requires significant investment. we have to go past the whole context as profit as not good, right? Value creation is good for all. All consumers demand, all taxpayers should demand value for money, right? You and I are taxpayers. We have equal rights on demanding value for money. We must provide a social security net.
Yes.
I think it's hard to imagine where the social security net is not strong enough and then expect people to pay for services. So I think we have to provide for both.
Of course. You gave me a lot of thinking points for questions after. But when you were talking about, not putting a band-aid on things, the healthcare sector was anyway a little dampened by, challenges such as, for example, all the, I would say, threats that were given because some or maybe a majority of healthcare professionals did not have their needs met. So there were, strikes and things like that happening. What did Cyclone Ditwa do to the existing challenges?
I think it exacerbated them. It frankly exposed a lot of vulnerabilities, frankly exposed sort of lack of investment in our disaster preparedness. The healthcare sector requires a more robust healthcare disaster sort of recovery methodology. I think there needs to be greater, connect with global agencies who can help us build that sort of infrastructure, that training. We must invest more in our public healthcare professionals.
Yes.
Yes, you will have efficiency concerns. If there has been erroneous recruitment in areas, if there has been political or opportunism in recruitment, yes, nobody will deny it. It can be addressed. But I think we need to have a social compact between the willingness of us as citizens to adequately reward those who do the hard work in healthcare and education. Our tax money must go towards providing for both that education that allows people to enter the sector, and then they must be rewarded to stay in the sector. I believe we need to find long-term solutions to that, and we cannot go crisis to crisis making short issues. But I also believe you probably have to ring-fence emergency services from strikes, from such a disruption. I think we have to find a balance, but there is underinvestment. And I would happier if my tax money went towards the healthcare and education sector more than other areas. Less subsidies and more in this would probably be a good direction to start. I think overall the current government is focused on long-term national strategic priorities. Our role as the private sector is to contribute to those ideas. Inefficiencies are always there. We find them in the private sector as well. So I don't think we should harp only about that. Simple accountability metrics like the thumbprinting, etc. I'm positively surprised by the government's willingness to hold on to that as an accountability measure. That gives me hope that my tax money will be better used for those sort of productivity gains. But we need to pay our healthcare workforce better.
And we saw that, of course, there was a big exodus of talent going out. And now with the floods, everyone's talking about, the fact that we need more people, to come back. What exactly does this mean for the healthcare sector, which actually lost a lot of people?
I think the healthcare sector was particularly affected by the economic crisis because of the mobility of that sector. I think we underestimate the mobility of the healthcare workforce. So many countries are willing to offer a much better deal for our healthcare, whether it's carers or it is nurses, whether it is for entry-level doctors or for our specialists. Across the healthcare spectrum, there is demand. The world is aging. There will continue to be demand. So if we don't take that into account, we will lose. So I think we really need to now step up and provide incentives for our healthcare sector team, workers, employees, citizens to stay in the country. So it also comes from quality of life. You and I know when somebody is migrating to New Zealand, Australia, it's not just about pay. The quality of life for the next generation is a significant challenge, and it's only fair for them to want better. All of us want better for our children. Right? So in that perspective, I think we have to address that. And pay is a good starting point. Right? I think sticking our head in the sand about this matter is not going to make the matter better. And we can't just demand because you had free education, you must work here.
No.
Everybody who's a graduate has had free education. Then that demand must be for everybody. Why only for doctors? Why not for lawyers and engineers and every professional?
Sure.
Right? So yes, we invest, but I don't think by not addressing the root concerns of quality of working conditions, quality of pay, and general quality of life, this is a losing battle.
It's time now to take a very short break, but we'll soon be back to talk more about the healthcare sector.
Display your brand message on digital screens at prime locations. The largest digital advertising network in Sri Lanka. Emerging Media.
Welcome back to the show. We're in conversation with the Group CEO of Sunshine Holdings, Shyam Sathasivam. So many challenges to talk about, and since you mentioned that Sunshine Holdings has a very big supply chain in terms of drugs and medicine, the drug shortage would have definitely been I don't know, even quadrupled or maybe more than that with the floods. What is your assessment of the impact of that in taking into effect the entire country?
So yes, definitely a disaster like Cyclone Ditwa disrupts transport networks, disrupts supply chain. We are ready for shocks, but this was significantly more. I think to have such an impact across multiple provinces is always a point of concern. I don't think you can be ready for every disaster.
Yes.
So we responded. We were able to address it, and we are working through it. Any shortages, immediate shortages, I think are now being reasonably well addressed. I think the government has also stepped up. Private sector has resumed supply chain sort of gap filling. The medium long term of shortages, if you talk about it mainly in the government sector, is more a long term procurement efficiency issue, right? How do we purchase products, right? How do we plan for that purchase? How do we do demand supply planning? We require far more professionalism in those spaces, right? Far more ease of procurement. The current government is working on that, and I think that will resolve a lot. Transparency is very important. We have seen egregious examples of corruption in healthcare supply procurement.
Yes.
Clearly, those are unacceptable in any democracy. So we must call those out, right? And we must address those concerns in the system. Quality is paramount in a sector like healthcare, right? So we must build more robust systems. We have underinvested in our quality assurance mechanisms, right? We don't have good enough quality assurance labs. We don't test enough products. We don't do enough post-marketing surveillance. So then we rely on other bona fides, which have let us down in the past. So I think in that perspective, it's a procurement efficiency issue. The private sector can support, but it requires willingness to address the issue.
Shyam, we spoke of challenges from the supplier point of view or the government and private sector point of view. But when you look at the end user, the general public of Sri Lanka, in their eyes, what are the main challenges that they have to face in the coming year?
So definitely, I think the challenge I would always see is affordability and availability. And this is both pull on each other. You need quality products that are affordable. Quality shouldn't determine affordability, right? So I think we should be very clear about everybody has the right to quality products and it should be affordable. And of course, we must recognize across the 5 million plus households, everybody's affordability levels are different.
Yes.
The government provides for nearly half of our citizens with free medication. Hopefully, it's of good quality, and therefore that is important. But there are many of us who are willing to afford different types of products, different brands, as you will say, and we should be allowed that freedom too.
Yeah. Yeah.
The other end is availability, which is what I was touching on.
Yeah.
Different people require different products. You can't have a one size fits all.
So, no.
So we must allow for that. Affordability of care is also in the services sector. So it's in lab tests, in hospital care.
Yeah.
Is the government indoor patient service accessible? Is there waiting times?
Yeah. Yeah.
We do complain, but I think we don't have reference points. I think all of us have heard of the NHS and its challenges. We've
Yes.
heard about the US market and its challenges. Yes, our country's challenges should always be more of center of mind for us, but we should not underestimate that globally providing healthcare to all citizens in an affordable way for the citizen and government requires trade-offs.
Of course.
Right? I don't think there is a budget big enough to make everything available on demand for everyone. We must be truthful about that. There will be waiting times that are urgent and not so urgent. There's critical and not so critical. Those trade-offs must be made explicitly. We can't make false promises that everything can get addressed. Right? So I think that's what an honest conversation about the challenges ahead. Right? All of us as citizens cannot gripe about paying our taxes when we demand such services.
Exactly.
Right?
It's a give and take. Yeah.
We should demand accountability for our taxes. Right? And I would think spending on healthcare is a very accountable way.
Yeah. Shyam, as we reach the end of the conversation, I want to come back to something you said about digitization, because we do have plans to digitize the health system. I hope that those things are not going to be hindered too much, because we are right now in a more survival kind of mode. What would you think are the priorities in terms of the digitization journey?
So I think patient information, electronic medical records is a base sort of foundation level investment. I think the government is making some progress. We've had successful trials. In many ways isolated in particular locations, so we need to get to that digital backbone. I am positive based on the current government's national digital initiatives as we work towards universal identification, as we work towards that sort of cross-connectivity of government or governance delivered through digitization, that healthcare is clearly a subcomponent of that. It will happen. We are late. I think we must admit that we are late and take significant steps now to invest and move that forward. Most of our citizens now have expectations of digital, which is a good thing. Therefore, they will both demand those services and use those services. So I'm positive in that perspective. Global agencies like the World Health Organization can help us in this journey. The IMF is positive on investing in supporting us. The World Bank is positive on supporting us. So we must take that support and move forward. But we must be bold enough to make certain changes. We can't try to keep everything of the past the way it is and try to do this. You have to move forward now. Right? So I think I'm bullish on that.
Lovely. My last question to you, Shyam, is what are your recommendations to sector players, both public and private, on how they can get through 2026?
I think if we keep the patient at the center of our focus, uninterrupted access to medicine and care has to be the foundation on which both government and private sector approach any problem solving. I think the social compact with the government healthcare workforce is important. We can't keep underestimating their grievances and hope to build a successful healthcare sector while leaving such a large team within it whose core issues are unaddressed. But I think we have to ring fence emergency services and have that sort of mature dialogue between all parties. The quality aspect of regulatory work, the government's role has to be strengthened, but it must also be a level playing field with clarity for the private sector to innovate, provide new product, participate. Right? It can't be a stumbling block in terms of where it is. And finally, balancing affordability with availability. We sometimes chase affordability at the cost of availability, right? Or at the cost of quality. So we have to balance both, and it requires, I think, both sectors to work together,
Yeah.
right? Our success is found together.
We've been in conversation with the Group CEO of Sunshine Holdings, Shyam Sathasivam. Thank you very much. I loved the interview, full of insights.
Thank you. Thank you.
And thank you to all our viewers for joining us. Until next time, take care.
Don't forget to subscribe to our YouTube channel and follow us on Facebook, LinkedIn, Instagram and X. Thank you for watching and stay safe.